Hello friends, welcome back Mid City. Today's topic blood supply and nerve supply of the cornea. Blood supply of the cornea. The cornea is a vascular structure. Small loops derived from the anterior ciliary vessel invades its periphery for about 1 mm and provide nourishment. Actually, these loops are not in the cornea but in the subconjunctival tissue which overlap the cornea. Nerve supply of the cornea. The cornea has a rich supply of sensory nerve ending divides mainly from the long ciliary nerve which branches of the nasociliary nerve. The long ciliary nerve after arising from a nasociliary nerve enter the eyeball around the optic nerve along with the short ciliary nerve and run forward in the suprachoroidal space. A short distance from a limbus, these nerves pierce the sclera to the leaves or eyeball, divide dichotomously and connect with each other, and conjunctival nerve to from the precorneal plexus of the nerve. About 60 to 80 myelinated trunk from precorneal plexus enter the cornea at various levels. Examples sclera, episclera, and conjunctiva. After having gone for 1 to 2 mm, the stroma, corneal plexus loses their myelinated sheath, branches dichotomously and from a stromal plexus. Although some nerve end in the midstroma, most passes anteriorly and from a subepithelial plexus. The fiber from here penetrate the pores in Bowman's membrane, loses their Schwann cell, divides into filaments under the basal layer of epithelium, which extend between the cell of the wall layer of epithelium, and from a intraepithelial plexus. The nerve ending in the epithelium has fine Baird's filament. Thus, the cornea has an extensive innervational density which is highest near the central and the gradually decrease towards the periphery. However, these are no nerves central posterior part of the cornea, descemetic membrane and endothelium.